I'm Dr. Lauren Hartman, and today we'll be talking about 3D drugs. Your learning objectives for this video are to list age-friendly medications for the 3Ds: delirium, dementia, and depression. The most important thing to take away from this video is to start low, go slow, and sometimes just say no. For example, in delirium, our first-line medication is no medication at all. Non-pharmacologic treatment is the mainstay of treatment of delirium. The first thing you should do is reorient your patient. Remind them who they are, where they are, and what time it is. Second, early mobility can go a long way to reducing and improving delirium. Additionally, engaging patients in therapeutic activities can help alleviate the symptoms of delirium. Many older adults who are in the hospital are unable to get food and drink, so it's very helpful to offer this to them and reduces the incidence of delirium. Older adults with hearing and vision impairments also benefit from receiving their hearing aids and glasses, so make sure your patients have access to these. Finally, encouraging normal sleep-wake cycles, like turning the lights on during the day and off at night, can go a long way. In a noisy hospital, something like earplugs and a warm glass of milk at night can be very beneficial to patients. If your patients with delirium do have behavioral disturbances that pose a threat to themselves or others, you can use antipsychotics to alleviate these symptoms. Always remember that there are many side effects to antipsychotics, like QTc prolongation, sedation, extrapyramidal symptoms, and you may get a paradoxical reaction with worsening of symptoms of delirium. Haloperidol and risperidone are the least anticholinergic of the antipsychotics. Those two drugs, in addition to olanzapine and aripiprazole, tend to cause the least QTc prolongation, and quetiapine has the least extrapyramidal symptoms. This chart is a helpful resource for you to help you choose which antipsychotic is most appropriate for your patient, depending on their comorbidities and current clinical presentation. As I said in the beginning, always remember to start low. The starting doses of antipsychotics for older adults are much lower than the doses you would use for younger adults. For example, for haloperidol, a good starting dose is 0.25 to 1 milligram IV, which may be repeated in 60 minutes. There are also other oral and oral dissolving tablet options on this slide that you can use as a dosing resource. Start low and go slow. The second class of 3D drugs that we'll talk about today are medications for dementia. First, we want to treat the cognitive symptoms of dementia by using an acetylcholinesterase inhibitor or an NMDA antagonist. As with delirium, start low. For example, a starting dose of donepezil would be 5 milligrams QHS, which you should increase by 5 milligrams every 4 weeks up to 10 milligrams. An NMDA antagonist like memantine can also be used. Start low and go slow. In addition to treating cognitive symptoms of dementia, we also want to treat behavioral symptoms. SSRIs like citalopram are not only helpful for treating dementia-associated depression and anxiety, but can be helpful for alleviating behavioral disturbances that are associated with dementia. In addition to citalopram, behaviors like aggression and other threatening behaviors can be treated with valproic acid or lamotrigine. Some patients with dementia experience psychosis, and if psychosis is threatening to a patient's quality of life, antipsychotics may be an appropriate choice. It's always important to discuss with your patients, and more importantly their caregivers, that antipsychotics do have a black box warning for increased mortality due to cardiac disease and pneumonia if you're considering starting this medication. Symptoms like hypersexuality or physical aggression can also be treated with antiandrogens. Finally, the third class of our 3D drugs are drugs to treat depression. SSRIs are a good first-line therapy for depression in older adults. Start low and go slow, just like our drugs for delirium and dementia. Citalopram at 10 milligrams can be slowly titrated up if a patient's QTc is normal. It's important to note that this is a side effect of citalopram and should be checked before starting this medication. Escitalopram does tend to have fewer side effects and thus could be a good first choice in older adults. Mirtazapine is another medication that can be used for depression in older adults and could be particularly beneficial for older adults with sleep disturbances or poor appetite. It is important to note that mirtazapine must be titrated up to 30 milligrams to achieve an antidepressant effect. In summary, when you're treating patients for delirium, dementia, or depression, always start low, go slow, and sometimes just say no, particularly when treating the behavioral symptoms of delirium or dementia. That's all for now. Thanks for tuning in.